we spoke about the uterine balloon tamponade, where we said if a woman is bleeding too much after surgery, there's a way you can now what put in some balloons. So when you put the balloons, you inflate it just to compress the blood vessels and stop it. So there's this we're just trying to look at the types of balloons, you understand. So one of it is what's known as the Bakri balloon. Bakri balloon, this is how it looks like. Okay, so it's just a specialized intrauterine device. It's designed to control what postpartum hemorrhage, that's bleeding after childbirth, especially when caused by uterine atony. All right, so it was invented by Dr. Younes, Noaman, Bakri in 1999. Okay, that was the year which I was giving birth to. So it's still a tool that is in use. So how is it designed? All right, it's latex free silicone catheter. Size is 24 French, 54 centimeters long. Capacity, it can hold up to what 50 milliliters. All right, that's basically half of a liter of sterile fluid. That's either you're talking about normal saline or sterile water. Features: there's a drainage channel to monitor bleeding. Okay, rapid installation components for quick inflation. So how it works: it is inserted into the uterus. Okay, then you inflate it with water. This is a syringe where they inflate it with sterile water or normal saline. Okay, exert outside pressure on it will now exert pressure on the blood vessels that were bleeding, so to compress them, and this will help to it will help to stop the bleeding that is coming out. Okay, so clinical benefits, right, is minimal invasive, right, there's little discomfort coming up, preserves fertility, is quick to deploy, right, it's effective in stopping bleeding in about 85 to 90% of cases. So that's like, the success rate is high. Contraindication: when you shouldn't use it: if the woman has uterine rupture, if there's active infections, if there's heavy arterial bleeding that requires surgical methods, you understand. Surgically you can stop bleeding. If the woman is allergic to silicone, right, there's retained placental fragments. Okay, so you have to basically put out the retained placental fragments before you start this method. So that was it for the Bakri balloon